Later this afternoon I'll be discussing immunotherapy, and it's really often in immunotherapy that you focus on the cancers for which it works best. Lung cancer, melanoma, kidney cancer, head and neck cancer, Hodgkin lymphoma. We tend to focus on the cancers where it's already licensed and already used. But I'm going to look at the four most common solid tumours: lung cancer, bowel cancer, breast cancer, prostate cancer. Of course, in lung cancer there's so much to say, but in breast cancer, prostate cancer, bowel cancer, immunotherapy is gradually coming through there as well. Not necessarily just the checkpoint inhibitors we see in lung cancer, but some also other immunotherapy strategies. So I will be discussing how immunotherapy is used now for those common solid tumours and how that might change in the future. With bowel cancer, there's a lot of progress being made with the MSI high bowel cancers, the bowel cancers where there's particularly high numbers of DNA mutations in the cancer cells. And we know from experience that cancers with a really high number of mutations, they often respond best to immunotherapy. They're more visible to the immune system. It's easier to provoke the immune system into action and having meaningful benefit for the patient. But those MSI high bowel cancers, they're really hypermutated. That's only 5% of metastatic bowel cancers. So there's a lot of progress still to be made elsewhere in bowel cancer, and we don't have the strategies for that yet. In breast cancer, it's the triple negative breast cancers, the HER2 positive breast cancers that possibly are going to be the most amenable to immunotherapy. At the moment, the focus is all on the triple negative breast cancers because there's so few treatment options available for women with those cancers. But even in those triple negative breast cancers, it's probably again just a small subset, possibly small, yet to be determined, but maybe about 20 to 30% of those breast cancers will be amenable to immunotherapy. And then lastly, in prostate cancer, it's early days. A few years ago, people got excited because there was a dendritic cell vaccine developed and licensed for prostate cancer, but it turned out it was just too difficult to use, too expensive, and there were other prostate cancer treatments coming through at the same time that were cheaper and more effective. And so everything kind of halted in prostate cancer for a while. Now things are getting going again with the checkpoint inhibitors. There's signs of life, but it's still really early days.